Oncology Screening Program Coordinator for Banner MD Anderson's lung cancer screening program.
Hi, I'm Jill Jennings. I'm a registered nurse with Banner Health.
Was always told by my parents growing up that I was a natural born caregiver. I'd walk around the house with a little doctor kit and take care of my family, ask them if they ever needed anything. So my path has always kind of been predetermined. Working in oncology, I have been doing for 7 years now, but I've been working for Banner MD Anderson Cancer Center for 12.
I've been a nurse for 14 years. My current role I've been in for a little over a year. My first new grad position was as a nurse in a hospital, inpatient on like a med surg unit. And once I showed up on my first day, they were like, it's oncology and telemetry. So my very first nursing job was caring for cancer patients, and they've been my favorite group ever since.
I would say being a person as an oncology navigator to help others in their worst time when they need you most. It's also inspiring to my son, who now wants to go to school to be an EMT. So him seeing me take care of others is what motivates me.
I think it's a calling. My servant's heart. I just love serving others. I feel so blessed to wake up every day and be able to serve others. And it really provides me a lot of fulfillment to help others out with their health. I don't think there's like a specific moment that I can say stands out, but just the role in general as I make changes to my workflow, like adding the Azra platform. I've really seen a big impact. It's led to a higher percentage of addendums being placed on reports with our group's recommendation, better recall rates, fewer patients lost to follow up. So overall, it's the little changes that are making a big impact every day.
I have several moments that have impacted me. I give intake calls to every patient, welcoming them to the lung cancer screening program. I review their medical history, and I answer any questions that they have. This one situation, a lady called me the day before her appointment, crying, saying, I want to cancel. She was scared. She thought that she was bringing lung cancer upon herself because it is smoking induced, and she didn't want to know the results. So we sat there and we talked on the phone, and just being somebody that she could talk to and cry to and express her feelings is impactful to me, because at the end she went ahead and did agree to have her lung cancer screening, and there was no findings. So she had peace of mind and was able to go about her day without walking every day in life in fear. Specifically from that last question, fear. Fear is a huge one. Patients are coming in for screening exams and they think that they've caused their own cancer diagnosis by smoking for so many years. Another barrier I would say is requesting prior imaging records. That helps our radiologists to do comparisons to find out if there's been any changes in nodules or if they're stable.
At the end of the day, I feel like preventative health screenings kind of fall to the wayside and at the bottom of the priority list. And so I feel like my impact is overcoming the barrier of just making those cancer screenings their priority. So ultimately, it's their decision to seek care and follow that communication to keep them on track.
To never stop fighting. Speak up for yourself, be an advocate for yourself, and allow family members to help you.
I'd encourage them to just explore all their options, make really well-informed decisions, get second opinions, and make the decision of what's best for you in your cancer diagnosis.
I would say that if you have empathy for others, this is a great career path, because you can listen, you can be a patient's person to call and go through one of the hardest times of their lives. I think that technology helps with early detection. It sees things that the naked eye cannot see, and it absolutely helps detect things and get those patients in to me quicker for screenings. And then I can then take that patient on from there and determine what the next step of care is that we're going to do.
Just being in this role helps me to maintain my wellness. And I think prioritizing myself by getting my morning workout in, filling my water jug up for the day, and taking those snack breaks when I need them. That's how I can be better for everyone else every day.
First thing first, I always have coffee in the morning. But I believe treating everybody as family members, every patient, every time, you should be giving equal treatment to. I treat everybody like I would want them to treat my family members or myself. My mom was just recently diagnosed with breast cancer, and the treatment that she received was phenomenal from Banner MD Anderson Cancer Center. And it just made me proud to say that I work here.